Before starting the video, listen this. You and you alone will define your limits. You just need to know your superpower. Hi everyone, welcome to Decode Nursing Concepts. Today is the day 3 of 90 days of practicing NORCET PYQ. Now, question for this session is infiltration cool and elevation portion at fluid state. Option are transudate, inflammation, edema, both A and B. So, before answering this question, we should know about infiltration or infiltration cool. Infiltration is entry of fluid into the tissues. While we are giving injections to the patients, it is going the surrounding tissues. If it is that vesicant, non-vesicant fluid, means that is not harmful, then it is called infiltration. Now, what is infiltration cool? The fluid which is we injected, which is that goes to the surrounding structure, the fluid is cooler than the body temperature. So when you touch that area, that you feel cool, so that is called the infiltration cool. Now, what is fluid state or fluid type? So fluid state is after the fluid is administered or it is gone into that surrounding structure, what state it is? It is edema, effusion or infiltration. That is called fluid state. Now fluid type is it transudate or exudate? So the first option is transudate. What is transudate? Transudate, it is the fluid that is non-inflammatory. That is because of like decreased hydrostatic pressure or increase oncotic pressure, means it is non, that is called the infiltration cool. Now what is fluid state or fluid type? So fluid state is after the fluid is administered or it is gone into that surrounding structure, what state it is? It is edema, effusion or infiltration. That is called fluid state. Now fluid type is, there are more terminology that are mostly coming in exam, that is extravasation, phlebitis, thrombophlebitis, hematoma. So what is extravasation? Extravasation is whenever it is same as that of infiltration, but in extravasation the vesicant, the harmful or the strong chemicals, strong injections are injected and that is leak into the surrounding tissues, like in chemotherapy, right? So at that we should not flush there. If there is any blockage, we should not flush that fluid, because you are more making that thing more harmful, more redness will be there. So stop giving the flush to the patient, don't flush that area. Now this is extravasation. Infiltration is the non-vesicant fluid का surrounding structure में जाना, that is infiltration. So at that time we have to stop IV and remove the cannula and we have to apply the cold pack. In extravasation, there is a, when the vesicant thing, the harmful chemicals, the more strong injections are administered, that is extravasation. Next is the then phlebitis. What is phlebitis? Phlebitis is there's inflammation or swelling of the vein, or that is because of any rubbing of the cannula or any drugs irritate the skin or irritate the vein, like potassium chloride or antibiotics or maybe the bacterial infection. Because of that, the phlebitis is there. In phlebitis, we are giving the warm compress, right? In inflammation, we are giving infiltration, we are giving the cold compress. But in phlebitis, we give the warm compress. This mostly comes in exam. Now IV antibiotics, when we are running for like 3-4 days or 5 days, then that vein looks like that red and tender, that is the phlebitis. Now what is thrombophlebitis? Thrombophlebitis is when there is phlebitis is there plus there is clot formation, when the vein gets rupture and there is blood is accumulated around that vein, that is the thrombophlebitis. How the patient will present? That is pain, swelling, redness will be there. So we are giving the stop IV, कोई भी IV injections, we should not push the IV injections, And in this also we are giving the warm compress to the patients, right? Or any anticoagulants if required, then we are giving anticoagulants, right? So the major differences: in infiltration the cold pack is given, and in phlebitis, thrombophlebitis, warm compress is given. Next thing is hematoma. What is hematoma? Whenever you bumped over something और आपको जैसे चोट लग जाती है, then there is a bruising thing is bruise after the when you are bump over something. So क्या हो जाता है? The blood leaks under the skin from that punctured vein. So there is a hematoma formation will be. At that time you have to apply the cold compress, and after some time then there is a warm compress is given. So this is all about different types of question that are being asked from this topic, right? The next question for this session is, which position is given to the patient who is having air embolism? Now the answer of this question is, the position is given is left lateral Trendelmer position is given. But why? The air first enters in the right atrium. From there are more chances that it get into the pulmonary artery, and it can cause the pulmonary embolism, and that is very fatal for the patients. For that we are lying the patients to the left side, and the air is just get trapped on the right atrium itself. But what is the treatment for that? For the treatment we are giving hyperbaric oxygen so that it shrinks that air bubble. Second is, we are, if there is a patient in a central line, we aspirate that bubble, monitors the vital of the patients, check for the shock, any other any other side effects we will see. So that's all about this session, and keep practicing, keep learning. Thank you so much.